We are deliberate about this because from when they are pregnant, we want to start giving them information about family planning. Nowadays, there's some method you can take up even in the delivery room. And when they bring their children for immunization, we also want them to talk to them about family planning. They hope that they will take up a method.
With the post-pregnancy family planning education and more of private sector involvement, many people will no longer have to wait for weeks after childbirth to take up a plan. This was the thrust of a family planning roundtable with a journalist in Lagos titled ANC, Immunization and Delivery Points as Catalysts to Improved Family Planning Uptake. The initiative is also to help the Lagos State government achieve a 74% contraceptive prevalence by the year 2020.
There have been several stories of people who, as a result of just continuing getting pregnant, because the woman is not strong enough, in the process of even putting to bed, she ends up losing her life.
Like the story of Adewale Astrop, a colleague of mine once went on a 3-month maternity leave and resumed work with another pregnancy. The health implication of such for any woman is better told than experienced.
The World Health Organization advocates that a woman should wait at least 2 years before the next pregnancy, and this has implications for a woman. It allows a woman to recover. Rapid succession of children can make a woman anemic. Her body has not returned to the pre-pregnancy status. She's prone to miscarriages. Too frequent children can lead to very low birth weight babies because these babies are born before time because the uterus has not relaxed and they are born very ill.
It is in a bid to avoid such mistakes and promote the uptake of family planning among Nigerian women that the Post-Pregnancy Family Planning Initiative was birthed.
And when we say post-pregnancy period, we're talking about women from when they deliver to 1 year after delivery. And we are really concerned about these women because they are not very intentional about family planning.
The forum also provided opportunity for questions on the various methods, myths and misconceptions about family planning.
Family planning does not cause health implications for women or even men, as it were. However, our bodies are also different. So some will say they have developed headache, or what some people call migraine. Some will say their breast gets bigger. But the truth is, because our bodies are different, some will not even experience any, what we call undesirable effects at all. So this means that when you go to a family planning provider, some of these things are things that they will tell you that you will experience. And they always say that if you experience any of these, please come back to the facility so that such things could be regulated or corrected.
Family planning, there are various methods, which, bleeding from even the natural family planning to the artificial family planning with contraception, etc. So depending on what you want, that's why you go to a family planning provider, and they will advise accordingly. There's not one size fits all. So if one family planning method does not work for you, you can always be counseled, and that's why we are emphasizing that there must be effective family planning counseling.
Nigeria's maternal and child death indices are one of the highest in the world. For experts, the increased uptake of family planning will help to improve on these poor health indices through adequate planning and check population growth. Gloria Daniels, Insight TV.